Hi, my name is Bridget McCarthy. I'm an Irish traveller. I work for ITMB. I also work with the Royal Free Hospital in the maternity section. This DVD is to show to travelling women out there that there's things coming forward now for them in pregnancies in the maternity level throughout England and Wales.
For any travelling woman that's going to have a baby, I suggest the Royal Free is a very good hospital.
My name's Emma Hardwick and I'm the consultant midwife here at the Royal Free, and my remit is really normality. So as a midwife, that's our role, is really to look after women in pregnancy, during labour and afterwards. It's been a journey with the travelling women and us working in partnership together to begin to understand some of the cultural diversity that Irish travelling women have, and how we can interpret that to enable them to access maternity care. The first few sessions were really very much about beginning to build up some trust and beginning to understand where we wanted the project to go. The project remit was very much about raising cultural awareness for the hospital staff about Irish travellers, but also for us to actually provide some information about maternity services. All of the sessions haven't been conducted here at the Royal Free. It's been very important that we've been out and about with the women, and we've been to the resource centre at the Holloway Road a few times. Some of those sessions have been a structured session where we've had different women coming in and talked about pregnancy-related issues.
So now if you try and breathe through the nose, the tongue to the one. Yeah. Try and breathe through the mouth. Yeah. So now we're going to go on to the next section, which is dealing with someone unconscious.
We'd had a kind of tell 10 idea, which was if we tell 10 people about some services, and or expectations or things that you can get and access, say while you're pregnant, then they tell 10 people and they'll tell their daughters. So like over 5 years, in theory, everyone should know. I know doesn't necessarily always work like that, but so far so good. And so yeah, I would like to see a continuation of the rapport between the hospital and the travellers. I'd like to see the message continue to be passed through the travelling community. And ideally, I would like to see an improvement of the kind of terrible statistics that we've continuously come across about life expectancy, infant mortality, cot death, and all these other horrific numbers that we see on a daily basis.
My name is Chantel and I'm a receptionist in the antenatal and gynaecology clinic. I'll be your first point of contact if you're coming to tell us that you're newly pregnant or you're coming for another appointment. You'd come up to my desk and check in with me there. I'll tell you that there's a form that has to be filled in, and if you needed any help, me or one of my colleagues are more than happy to help you and sit there and fill it out and ask you the questions ourselves.
I'm Alison Wright, I'm one of the consultants at the Royal Free. So I deal in maternity and gynaecology, women's health. So basically women would come to me if they had a problem with the pregnancy or the labour or afterwards.
I'm Sally and I run the ultrasound department at the Royal Free Hospital. For the patient to have an ultrasound, it's a great way of bonding with the baby, so they can see the baby on the screen, they can see it moving around and the heart beating, and really to be able to see the outline of the baby, see all the structures, and that's usually a very good experience for the mother.
My name's Deborah, I'm a midwife, been a midwife for 7 years now. Midwife is a professional person who looks after ladies when they're pregnant, during labour and in the postnatal period at home.
My name is Ruth Akoto Appiah. I am the maternity matron for the inpatient services at the Royal Free Hospital. The role encompasses coordinating the care of women following the birth of their babies.
And then when we get to 12 weeks, the baby will be about just over 6 centimetres long. And I measured my thumb. I've probably got an average woman-sized thumb. And that's about 6 centimetres. So that's how big the baby will be. So from 4 weeks, grain of rice, to the size of the thumb at 12 weeks.
From my experience as an older woman now, and that I would say that from the minute that they know they're pregnant, that they should go straight to the maternity unit or their doctor's surgery, seek advice, go to all their maternity checkups.
From the time that they find out they're pregnant, they should see somebody the whole way through and make sure and go to doctor's appointments and antenatal clinic and that, because a lot of them don't do that. Yeah, I think for themselves and the baby would be safer.
When ladies find out that they're pregnant, they can either go straight to their GP who can refer them to their local hospital, or they can actually self-refer, so they can contact their local hospital. There'll be referral forms which they can fill in online as well.
We do know that in all communities, domestic violence increases when women are pregnant. So it is something in maternity that we're very aware of, and we do have help access to support for women if they are experiencing domestic violence and they want us to help and support. And that's very individual. Sometimes women would prefer not to, they just want to talk about it. But if they do want help and support, then that is available.
It's also very important to access care early now because there have been a lot of changes within the screening that is offered for women during pregnancy. And a lot of this screening will take place within the first 3 months. So we like women to come and see the midwife early in pregnancy, so we can explain everything to them. We can provide them with lots of information so that they can make decisions about what care they want, and if they want screening, to be able to understand the reasons for that screening in a controlled way and not in a rushed manner, so they can make the right decisions for them and for their baby.
We do offer antenatal classes during the antenatal period, normally when people are about 30 weeks pregnant, where we educate them on postnatal care as well as the labour care.
And it should be an enjoyable experience as well, definitely. Mums should be, enjoy the process and know what's happening, and if there's anything they need help with, and midwives are here and doctors and everyone to give them that advice and reassurance if they need that.
It's important for ladies to remember as well that they can access hospitals and maternity care wherever they go, and even though they may have booked at, say for example, the Royal Free, if they're staying in a different area, that doesn't mean that they can't access maternity services there if there are any problems or concern, or obviously if they go into labour unexpectedly.
Women have a few options for their place of birth. What we offer here at the Royal Free is that they could have their baby at home. The midwife will discuss that option with them, but what we need to take into consideration together is whether there are any risks associated with that choice. Another option for birth is that the woman may choose to have her baby in the birth centre, which is attached to our labour ward, and they have total midwife care. The third option is the labour ward, which is for more complex births. We try to make it as normal as possible, but there may be further assistance with maybe monitors to monitor the baby's heart.
I and the other team of consultants and doctors are on hand if there was a problem. For example, if the baby became distressed in labour and the woman needed an emergency caesarean, I would be on standby then to help and do the caesarean.
Around visiting, on labour wards we tend to have two birth partners that are able to support you during your labour. In the postnatal ward, when you're transferred, again, it's two. We do have a waiting room outside, so visitors can often swap. The visiting hours for a partner or a significant other, that starts from 10 o'clock in the morning all the way through till 8 in the evening. So it's quite a long period. The rest hours between 1:30 and 2:30. For other visitors, it's from 2 o'clock till 8 o'clock. After you've had your baby and transferred onto the postnatal ward, again, it depends on the type of birth that you've had. For a woman who's had a normal delivery, so vaginal delivery, it can be anything from 6 hours up to 12, 24 hours. Again, that's a discussion between yourself and the midwife, and when you're comfortable to go home, and how you feel that you might be coping with the baby.
I think with travel women, especially if after they've had a child and if they do have to move, it's vital that they have to keep up appointments for them and for the child.
Sleep as well, like you said before, you've got lots of people. We can give reassurance and what's normal and what sort of signs to look for if a baby's poor feeding or if baby's not getting enough at all. So we can advise, which is again really good to have the community midwife come into your home that can give you all that information. Sudden infant death syndrome is it's very, very rare. We don't know what the reason is. Fortunately, it doesn't happen often at all, but you know, we do need to make sure ladies are educated and aware. What we recommend is to always place baby on their backs, always with feet towards the bottom of the cot, not in the middle of the cot, so that way baby can't roll. So we're just tucking the blankets underneath, so there's nothing that can cover baby's face, making sure the temperature is okay and baby's not overheated. And we do know one of the key factors linked to cot death is smoking, so we always recommend not to smoke around baby. Obviously, if you've been taking alcohol or drugs, we highly recommend that you not to have baby in the bed with you, also not to have baby in armchairs. With car seats, we should use them for a limited period of time.
I knew a travelling woman. She suffered postnatal depression after she gave birth to her third child. She didn't get it in her first two children, but she got it in her third child. And she didn't want to know the baby. She didn't want the baby around her and stuff like that. So it is important to learn about that and to seek the advice and help that's there.
Baby blues are normal. They last a couple of days and they go. But if it gets any worse than that, get help. Really, they need help. Speak to the health visitor, the doctor. You know, there is help out there.
I have seen women who have been at the point of feeling suicidal and then through a combination of counselling and some medication have then come back to their normal selves. But if they'd known sometimes that help was there, may have got that sooner.
They should either talk to someone belonging to them, like their mum or older sisters or something, and also maybe to the doctor to let them know that they're not feeling right, that there's something wrong.
There is still a stigma, and I think it's only by talking about it and reaching out for help and supporting each other that we can get rid of that stigma.
I'd like to say a big thank you to all the women that have been involved with this film, because without them this wouldn't have been the success that it has been. So thank you all.
I would also like to give a big thank you on behalf of myself and all the Irish travellers and Gypsy women, to give thanks to Emma and all the staff at the Royal Free Hospital for making this possible. Some of the filming was done by ITMB Youth Group. Music by Wywood Wolf Media. Filmed and directed by Flexible Films.